Human immunodeficiency virus is a virus from the family of lentiviruses. The viruses present in this family are simian immunodeficiency virus, feline immunodeficiency virus, and equine immunodeficiency virus. Among lentiviruses, HIV is the only one able to infect humans, and if left untreated, it can lead to the acquired immunodeficiency syndrome, generally referred as AIDS. Hi everyone, it's Jobs here. Today we are looking at what is HIV, its pathogenesis, symptoms, treatment, and current advantages in research. To begin with, there are two major types of HIV, HIV-1 and HIV-2. HIV-1 is the most common form of HIV, and HIV-2 is very uncommon and less infectious. Both types are very similar, and HIV-2 is so uncommon that most of the time when we refer to HIV is always HIV-1. HIV attacks the cells within your immune system, lowering your defenses against common infections and even tumors, which normally would not pose any threats. Over time, your defenses become so low that fatalities could be near the corner. This stage always refers to AIDS. So HIV starts its spread inside the human body by attaching himself to CD4 receptors. These CD4 receptors can be found in some cells within your immune system, such as dendritic cells, macrophages, and helper T cells. This receptor is extremely important for normal immune function, but in this case, it is utilized by HIV as an accessible door for infection. HIV attaches himself to CD4 using the protein GP120 on its membrane. But even though it has found a door for access, it still requires the key. In fact, to penetrate the immune cell, HIV must bind with GP120 to both CD4 and a co-receptor, either CCR5 or CXCR4. Interestingly, people with homozygous mutation in the CCR5 receptor are immune to HIV, and people with heterozygous mutation of the CCR5 receptor progress slowly to AIDS. Although mutations of CXCR4 receptor are quite dangerous for various reasons, P191 mutation is reported to safely inhibit HIV infection. Once HIV has penetrated the immune cells, it releases its components. These include enzymes and viral RNA. To replicate and spread, the virus needs to get access to the immune cell's DNA. Normally, RNA cannot penetrate the cell's nucleus, containing the DNA. But thanks to the enzymes present in HIV, this becomes possible. HIV uses the enzyme reverse transcriptase to convert RNA into a proviral DNA, which is then able to mix with the DNA of the immune cell. Now that HIV's genetic material is inside of the immune cells, transcription and translation of the hijacked DNA will result in the production of more HIV viruses that can live and infect other immune cells. Now, during normal infections, a very important role is covered by dendritic cells. These immune components are like sentinels capturing available hostages in the battlefield and bring them in the headquarters. During HIV infection though, this results in a double-edged sword scenario. To clarify, when dendritic cells capture HIV and carries it into the lymph nodes, where most immune cells are present, allows HIV to infect many of them. This causes a significant spike in HIV replication observed in patients' blood. HIV infection can be characterized in three phases. The first phase is known as the acute phase. HIV-made cells start to rise and patients' CD4 cell count start to decrease. Here, many will experience flu like symptoms, lasting around 2 to 4 weeks. However, the immune system will start fighting the disease, and this is observable by a slow rise in immune cells and a decrease in the amount of HIV in blood. The second phase is known as the chronic phase. Here, the virus will be silently replicating. Only in some individuals, new infections and other symptoms start to appear, as defenses decrease and reach low levels, around 500 immune cells per microliter. As you can observe, the chronic phase is characterized by a slow decline in immune cells and a rise in HIV cells. This phase could last around 10 to 15 years, or even more. It is important to know that when a virus has more room to replicate and spread, the chances of it to acquire mutations increases. Reason why, in the acute phase, some patients will develop the X4 strain of HIV. This mutation allows HIV cells to bind CXCR4 receptor present in the CD4 T cells, causing their gradual decline. The third phase of HIV infection is the life-threatening condition AIDS. Here, extremely low defenses are observed. In fact, CD4 cell count below 200 cells per microliter. AIDS symptoms include rapid weight loss, recurrent fever and night sweats, diarrhea lasting for more than a week, and other fungal and bacterial infections. Also, cancers tends to develop as immune defenses are extremely weak, and common cancer in AIDS are lymphoma and Kaposi's sarcoma. Lymphoma is characterized by painless swelling of lymph nodes in neck, armpit, or groin. Kaposi's sarcoma is characterized by lesions on the skin and mouth. With normal immune system, these illnesses will not appear or be life-threatening. In HIV, most common routes of transmission include unprotected sexual relationship with a partner carrying the virus, as fluids and blood can carry HIV. HIV can spread upon unprotected sexual contact with these fluids. Other routes include sharing infected needles or mother-to-child transmission during pregnancy, birth, or breastfeeding. Extremely rare transmission routes include oral transmission by kissing, biting in presence of bleeding gums. It is important to know that saliva is not a vector for transmission. Tattoos and body piercing by using infected equipment, or female to female transmission. Diagnosis of HIV is done through antigen or antibody tests, where a blood sample is analyzed to check for the presence of HIV substances known as antigen, or substances produced by the immune system as a reaction against HIV infection, known as antibodies. It is also possible to perform nucleic acid tests, which look for the viral load within your blood. After diagnosis, and if resulted positive, CD4 T cell count, viral load, and drug resistant tests are carried to determine the stage of the infection. As of 2022, there is no cure for HIV yet. Antiretroviral drugs are treatments available to stop the virus spreading in the body and reduce viral load significantly, to a point where the virus is no longer detectable in blood. This also lessens the chance of HIV being transmitted. However, this point is reached if the medication is taken regularly for a lifetime. Cases have been reported where patients were able to be HIV free even without antiretroviral treatments. The first case was reported in 2011, the second and third around 2020 and 2022. Media outlets report this as a novel treatment being discovered. However, there is more to this, and a cure for HIV is still far away. In fact, the first two patients obtained HIV freedom through bone marrow transplantation to cure leukemia and Hodgkin's lymphoma. Instead, the third patient obtained freedom through cord blood transplantation to cure a different form of cancer. You can already understand that these interventions were not for HIV itself, but primarily for cancer. Also, bone marrow and cord blood transplantation have important complications, and listing all the issues from such invasive medical intervention would not fit this video. I hope I did earn a like and a subscribe from you. Thank you for watching this video, and I hope to see you in the next one. Cheers.